On behalf of Project Switch, welcome to the second training for school nursing cadre team members. I am Beverly Burke, President of School Nurse Organization of Oklahoma and the School Nurse Cadre Nursing Team Leader. In today's training, we will identify strategies that mitigate the spread of COVID-19 in the health office. We'll designate health space and sick space in the health offices. And we will apply techniques to promote the safety of caregivers in the health office. We'll differentiate symptoms of COVID-19 from other illnesses and recognize chronic health conditions that increase the risk for severe illness from COVID-19. As we learned in our last training, a quarter of the students of school populations have a chronic illness. Studies note that students who leave the classroom to seek nursing care more than 4 times per year have increased academic risk of poor performance and lower test scores. In addition, well students who visit a nurse clinic may be more at risk for contracting contagious disease. Therefore, it is essential to protect and support children with chronic illnesses. Protecting and supporting our children in school always begins with mitigating the risk via physical distancing of students and staff where possible. In order to prevent potential exposure for vulnerable students, we suggest that all student visits to the health office be triaged. Triaging a health visit can be accomplished in many ways. Some simple ways are for the staff to email or call the health office with a request for an ill visit, or more complex would be to create an online nurse visit request form. Staff who are requesting to send students to the health office for an ill visit might also include student complaints and symptoms and behaviors in the classroom that would give the nurse a good picture of what's going on to make a decision about how much of a priority that visit could be. Receiving advance notice helps the healthcare worker to prioritize the visit and clear the space to protect vulnerable, prepare needed equipment and supplies, and to don PPE. A good example of this would be, say, a diabetic was in the health office doing a routine check when a teacher called to send a student who had a headache and didn't look well, looked like they might have fever, down for a nursing assessment, that we wouldn't want those two passed across. So we could tell the teacher will give me about 5 minutes, then send the student down, and that time clear out the diabetic and get that student back to class and be prepared for a sick visit. In mitigating space then, or mitigating risk then, starts with designating a space for entry to the health office. Now, I've called it a stop zone just because that I could use the stop zone emblem, but you could call it a wait zone or you could just call it entry. But whatever it is that sets a place for students and staff to wait to be directed to the area that the nurse wants to assess in. Stop zones can prevent contamination of the environment by controlling physical activity in the environment. I know I have students that come right into the office, go right up to the counter, touch my computer, give me a hug, and I've had to train them to stop and wait for me to be ready for them. And staff often have priority concerns and they come right in as well, not knowing other risks that might be in the office. So starting that visit with a stopping place prevents mingling of students and staff and controls the health office pathways. There are a number of ways to accomplish a stop zone. I've seen just a red stop sign cut out on a piece of construction paper and put on a door and the door closed. Or I've seen things like a desk put in the middle of the entrance to the clinic so that the student has to stop right there and to go around it. Or even such more elaborate ideas such as physical barriers. In this picture, we have a filing cabinet with a plexiglass shield on it. And whatever it is that creates a place for people to stop and check in and find out where the next step is effective. Well students should always be separated from ill students by at least 6 feet. And I would say that where possible, pathways that are trafficked by well students should be separated so that the well students go in one direction and ill students go in another. All students should be masked by policy per school policy, and good airflow is always an important consideration. You can erect barriers for well space and sick space if there's room and ability. Barriers are effective, like a plexiglass shield that you see in this picture, but I've seen very simple barriers like a plastic shower curtain, or even just a piece of furniture, that anything that separates so that people are designated to follow a space toward a well zone or a sick zone is effective. Now, sick zones in schools are not total isolation as can occur in hospital settings. We don't have negative pressure airflow. We don't have immediate cleaning abilities in lots of spaces. So we really need to think about a sick zone as a separation zone, and that will mitigate the risk. Now, students in sick zones should be easily observed. No students left unattended. And sick zones should be easily cleaned and contain minimal environmental objects to clean after use. Some things to think about. Do you want carpet in your sick zone if the children are vomiting there? Do you want objects that children who are laying there might see and be inclined to pick up and hold or touch? And sick zones, when possible, and it's always best practice to have good airflow. Physical distancing is always important, and helping to train students and or staff and others to maintain a physical distance of 6 feet is important. When that can't be accomplished, then training to avoid face-to-face contact is important. Instead suggesting a 90-degree angle so that one face is 90 degrees from the other's torso, or suggesting a side by side or even from back to front approach is very effective. Now, delivery of safe health care to protect students. PPE for schools has been designated as high priority by the Department of Emergency Management. It's also been designated as high priority by OSHA and CDC. And yet there are a lot of high priorities with COVID-19, and so PPE continues to be an issue that staff talk about. What I found with PPE is that it's important to train our ancillary staff, students and staff, because there is fear of not having enough supplies and fear of not having enough protection. So training on when to use PPE, why and how is very important. And when possible, how to conserve PPE. So I've included these slides here for your consideration and training your cadres teams, and just to put in writing some of the areas to consider. The first is to anticipate the type of exposure. That may seem intuitive for nursing, but it's not always for ancillary staff, especially if they're afraid that they might be exposed. So helping them understand when air splashes or airborne particles or large amounts of blood and fluid might penetrate the clothing, considers the type of PPE they would want. The second is the durability and appropriateness for the PPE task. And this is a really big issue right now, because especially with the issue of gloves are being a perfect example. The cost of 5 mil gloves is exaggeratedly high right now. I've heard as high as $75 for a box of 100 5 mil gloves. But 2 mil gloves are in more plentiful supply. So if we can train staff on the difference of when to use a 2 mil glove versus a 5 mil glove, would be very effective in supply use. If you're handling a large amount of body fluids or performing tasks that damage a glove, then a 5 mil glove could be essential. But if you're cleaning or doing routine tasks, then a 2 mil glove is equally as effective for more supply and less and more economical. And the same could be said of surgical and N95 masks. I know I see people walking with N95 masks quite often in stores, and I think why? When surgical masks are quite effective for that. So just making the point in training of when and how to select the appropriateness of the PPE. And the third uh, consideration is fit. It is important that PPE is available in the sizes appropriate to the workforce. If you have real small hands, you don't want large gloves flopping. If you have large hands, you can't fit into a small glove without tearing. So important to train on the size and the availability and having availability for all the sizes that are needed in the areas of the school. Acquiring supplies is still an issue. Some of that I think is fear associated with not having enough. Some of it is that there really truly isn't enough. And some of it is just knowing what supplies are needed to be used in what situations. Um, no, I think I skipped a, guess I didn't. So let's address first the area of enough supplies. If you still have areas that are not receiving enough supplies, then the first step is always to direct them to their administration. Their administration may have contracts in process. Like I know we have contracts to receive supplies in September and January. So there may be more coming, and we would want them to know that information. And they may also have contracts with suppliers that are going to provide supplies as they come into resource. There is a statewide PPE resource directory if they're having trouble locating supplies, and that link is there. And also, the offices of emergency management and the health departments often know where the suppliers are that are more flush with supplies and can help get schools supplies that are needed. And not to rule out our community and our tribal partners. I know I received a call from a MER group wanting to know if they could donate any supplies that were needed for schools. So there are groups of people in the community and in our tribes that are ready and willing to help if there truly is a need. Now, training of our staff is really important with using supplies prudently. And a good example of this is cleaning versus disinfection. I had staff that were concerned because they were running out of Lysol wipes in the classroom. And I asked how they were using the Lysol wipes and they said, well, we have our students clean with the Lysol wipe at the beginning of class and at the end of class. So they were using every 40 minutes, they were using 2 Lysol wipes per student as they were going in and out of class. And there's a severe shortage on Lysol wipes at times. Sometimes you can get them, sometimes you can't. But at some point, we have to ask, do we really need to use a Lysol wipe? And what was the difference between cleaning and disinfection? And adequate cleaning can be very effective accompanied with adequate hand washing, and then therefore not needing to Lysol that desk every 40 minutes. So trying to understand the use and the need and then training is very important. Reusing and sanitizing supplies. In general, most PPE is designed to be used only one time by one person. However, in schools, in COVID, making good decisions about reusing PPE is possible. Reusing PPE face shields, goggles, masks, and gowns may be possible and can be reused until they're soiled, moist, or visibly deteriorating. Mask storage is an important example of this because masks are often taken on and off in the school environment for mask breaks and recesses and lunch and those kinds of things. And it isn't always necessary to have a new mask. There are several ideas for reusing masks. The issue with masks is that we don't want them laid on a counter or put in a pocket or someplace where other people would handle them and then become contaminated to the outer surfaces. Some examples that we've seen include using the paper bags and cutting a notch out at the back and having the front of the mask face the front of the back of the mask face the back of the bag, and then handling the mask simply by the ear straps and not touching the actual mask itself. Very effective use for reusing masks during the day and very effective at reducing contamination. Another example I've seen is masks that are rotated. I know one staff member that has 5 masks and she has 5 bags and she rotates Monday mask, Tuesday mask, Wednesday mask, Thursday mask, Friday mask. And that works for her and she doesn't have to, unless they're become extremely soiled or deteriorating, then she changes them out. Another idea is that masks can be UV sanitized very effectively. Our district did purchase UV sanitizers, and it takes about 10 minutes to sanitize a mask and with no visible deterioration. And research studies show that that is a very effective method of decontamination and sanitizing. Gowns are, again, another example of things that could be used. Now, please, or could be reused. Please note, I'm not suggesting reusing gowns that have been used in care of ill students with copious mucosal discharge, copious coughing, vomiting, or diarrhea. But there are times when a gown is donned, but not necessarily contaminated visibly or wet. So there are times that we do reuse our gowns, and it can be done as long as care is taken to avoid contamination of the outside of the gown to the physical environment. And this is an example of how a gown can be folded from the outside inward and hung up for next use and then put back on without without touching the contaminated outer side. But that needs to be trained and taught for non-nursing caregivers. Shields and goggles can be cleaned first and then sanitized with a disinfectant. And again, UV sanitizers are very effective in goggles and face shield cleaning. Okay, it's time for a brain break. I'm going to give you a set of 5 questions. And at this time, I want you to stand up, take a stretch and a deep breath. And if you think that the statement I give you is true, you'll do a jumping jack. If you think the statement I give you is false, then jog in place. And we'll get our brains and our blood moving a little bit. Okay, the first one, the first statement, the most common symptom of COVID in children is a cough. If you think that's true, do a jumping jack. If you think that's false, jog in place. The second statement, COVID toe can occur on heels and fingers as well. If you think it's true, do a jumping jack. If you think it's false, jog in place. Third statement, children with COVID come down ill very rapidly. If you think it's true, do a jumping jack. If you think it's false, jog in place. Number 4, children with chronic disease are more likely to catch COVID. If you think that's true, do a jumping jack. If you think it's false, jog in place. And number 5, coordination of care for children in schools with chronic disease is the teacher's role. Again, if you think it's true, do a jumping jack. If you think it's false, jog in place. Whew, are you all exercised and more blood flow now? Let's go on and learn the answers to these questions. Before we move to that, I want to put up the differential assessment of COVID and other illnesses that CDC has distributed. We did order these printed and laminated and placed at every assessment station. That they can be very helpful. And here's a QR code if you haven't seen or used that, or to distribute to your other schools. And then let's do differential assessment of COVID. You already know that there is no easy answer to recognizing definitive COVID symptoms. There's just not. But there are lots of researchers working on this issue, trying to correlate the symptom progression in COVID. And that's real important work. And the research continues to change. I'll say that this is just the most latest research that I found, and to watch for more. According to researchers right now, the most common symptom progression of COVID in children is fever, cough, and loss of taste or smell. However, they do warn to pay particular attention to fevers higher than 100.4, new coughs, especially uncontrolled coughing or coughing that causes difficulty breathing, not the clear your throat kind of coughing, and new sore throat, not the tickly sore throat, but the painful sore throat. New onset of diarrhea and vomiting or stomach ache, then new onset of severe headache, especially with the fever, and sometimes COVID toe, which is purplish spots or rashes that show up on the toes, heels, or fingers. You recognize that question? Okay. COVID versus flu first symptoms. The first symptom of COVID by researchers is likely to be fever. The first symptom of flu is likely to be a cough. The timing of COVID is that children tend to get sick over time. They have a day or two of not feeling really great, and then it progresses. Whereas with flu, individuals with flu tend to get sick very quickly. Oftentimes they can tell you, boy, about an hour ago, I just started feeling terrible. Recovery rates with COVID and flu. Recovery with COVID in moderate to severe disease is more slowly than flu. Flu individuals recover faster. However, asymptomatic or mild disease of COVID recover about the same rate as flu. Current evidence suggests that children with medical complexities are at increased risk for severe illness for COVID-19. However, they're not at any higher risk for contracting COVID-19. So the takeaway from that is if they get it, they're more likely to become severely ill, and that's why it's important to prevent that exposure. Children with congenital illnesses such as heart disease, genetics diseases, neurological, pulmonary, or metabolic diseases, children with obesity, diabetes, asthma, sickle cell, or immunosuppression are especially vulnerable for severe disease from COVID-19. This is similar to adults. So we know how to mitigate the risk, and we know how to recognize likely patterns of spread of COVID, but we still feel, what can we do? How can I help? And that's what this last summary slide puts out. First of all, what we can do, we can plan. We can plan to reduce the environmental risk, environmental health care, environmental separation and mitigation zones, and spatial zones for children who are well versus children who are not. We can coordinate healthcare with teachers and parents, medical professionals, and tribal partners. Important to recognize that it is the nurse's role to initiate the coordination of that healthcare and let teachers and parents and staff members know the strategies that will protect those vulnerable children, and to ask for help in contacting our community and tribal partners when needed. We can recognize illness early. We can get that child referred for early medical assistance, because especially in our children who are more vulnerable, because we know that they are more likely to have severe disease, and we can stop that uh, or prevent that from progressing if we recognize and refer early. Okay, in conclusion, school environments present challenges to maintaining social distance and challenges to preventing spread of communicable disease. Yet, with careful planning, risks for vulnerable students and staff can be mitigated and wellness can be promoted. Here's a list of the resources that I use, although it's not comprehensive, it's just the most prevalent ones in preparing this information. There's lots more out there. I want to point out the last one that's in the slightly different blue color. That is from our National Association of School Nurses, Chronic Health Condition Considerations, and that's a CEU learning module that's very effective. I am Beverly Burke, and you have my email and my phone number. Call, text, let's collaborate, let's suggest ideas, let's troubleshoot. As you're talking with your schools across the state, they will have individual needs and we'll have to come up with individual solutions. So let's collaborate any way that we can help you. And of course, Shayna Clausen is our team director for Project Switch, and she's amazing with her resources and her ability to help us. So we always want to be able to reach out to her as well. And we give her a big thanks for all of her help in promoting this project.